This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy.
And we are back with Vera Kay, who is awake, sitting front and center with the Berman Method podcast, where we're focused on treating problems and not symptoms. Dr. Jake Berman here with my two beautiful co-hosts,
Jenni Berman, physician assistant.
Vera Kay, Berminator.
And Vera Kay, who is 2 months old. More than 2 months old.
Where's the time gone? Oh, she just smiled. For everybody listening, we're finally getting smiles on demand now. This is exciting and rewarding. She's not just some baby blob sitting in a boppy anymore that just wants to eat and cry and sleep. Now she's actually responding. So this is fun.
It is fun. A little personality. And she is tough. Her sister is a bowling ball with her, and she's tough. I think Stella's the bowling ball and Vera's the bowling pin, right? But the second one always is tougher.
Has to be.
Yeah. And I think the third one is always the badass.
You think so?
I mean,
is that because you're the third?
I broke siblings' tailbones in my life. I was tough. Yeah.
You had to fight for your scraps.
My sisters would beg to differ. They'd be like, "You had it so easy. You got away with everything." I don't know that I got away with everything, but I was pretty mean. I was tough in that aspect. I could beat anybody up.
What?
I don't know if I'm proud of that or not, but
Jeez Louise.
I was tough. But you have to be when you're the third one. All right, cool. So, happy Monday.
Here we are.
We're here. Berman Method podcast, treating problems, not symptoms.
Yes.
Go for it.
Well, what are we going to be talking about today?
I'm going to talk about supplements today, vitamins, supplements. It is something that we utilize in our practice for those who need it. We are if you're new to the podcast, we are a functional medicine practice. My side, the wellness side, is a functional medicine practice that focuses on nutrition-based medicine. So helping individuals to reach their goal weight, to heal their gut, to balance their hormones, improve their sleep, their energy levels, all the things we do more naturally through nutrition, and then checking blood work on the individual to see what kind of vitamins they're lacking or nutrients or minerals that they're lacking. And so we do utilize supplements per individual based on their body and their blood testing. So that's what we're going to be talking about today.
Okay. So it's not just a generic thing. I come to your office and sign up for a program and get the pre-filled basket full of goodies.
You do not get a pre-filled basket full of goodies. No, we do give you goodies as far as like snacks and things to try. But when it comes to vitamins and supplements, it has to be based on the individual. It has to be based on their blood testing, on their clinical history, or what we call subclinical. So they're presenting one way, but blood work may be showing a different way. And so we're able on a week-to-week basis adjust and modify what we're doing nutritionally and supplementally to make sure that we are seeing the progress that we want to see.
And there's definitely plenty of goodies upstairs. So whenever you're not in the office, I sneak up there, and I have a great relationship with your team. I'm like, don't tell Jenni.
Inventory tells all. We know exactly what you're taking. Mm-hmm. Mm-hmm. But don't worry, we check the expiration dates closely. So if something starts to expire, then it's yours.
Yep, it's all mine. I think this is great, though, because I guess it really started back in high school when friends would start getting into exercising and weightlifting, and then they'd start taking these supplements that are great for some, not great for all, but because it is the popular thing, meaning that it's in the magazines, it's in the advertisements, they think that it's appropriate for them. And this is just one version of it. I'm just talking about supplementation for bodybuilding, essentially. So protein, we could go on for hours talking about how the most popular protein out there is a whey isolate, which is dairy based. And there's so many people that have a sensitivity to dairy, not an allergy, but a sensitivity to dairy. So you're in the gym busting your ass for an hour or two a day, and you're really trying to make noticeable changes in your physique, yet you're supplementing yourself with whey isolate, and it's counterintuitive. It's causing bloating. It's causing an inflammatory response in your gut, and you're not going to get the results you're looking for. So this is just one perspective from my side, and we're not even talking about the real beneficial supplementation that you're talking about, where people will also do that. They'll see an advertisement in the magazine or on TV, and then they'll go to the health food store and say, I should take this because there is an ad on it. Yet you don't know that your body needs it. And you don't even know if your body can even absorb it.
Right, right. I thought about a couple things while you were going through that. And I had just told you just last week, I was listening to a trainer talk in the gym to one of his clients, and nothing against personal trainers. I'm a personal trainer. I was a personal trainer. Like that was my job at one point too. But the personal trainer was trying to educate his trainee on getting adequate protein, and he advised her, the trainee was a female and the trainer was a male, and he advised her to bring a scoop of whey protein to the gym with her to have directly after her workout, and then go home and have her smoothie. And so two things triggered me as I'm like, what if whey is not good for her? What if she has a dairy sensitivity and whey is actually going to cause an inflammatory response, which not everybody has, but generally speaking, whey is pretty inflammatory. And secondly, how much protein is he recommending within an hour of her exercising? Males and females need totally different nutrients when it comes to the amount of protein after their workouts. And so to have a scoop of whey protein and then go home 30 minutes later and have a whole smoothie just may not be the right macros for her body specifically.
A whole smoothie with another scoop of protein.
Yeah.
So we're talking about 2 scoops of protein, which is ballpark 60 grams or
between 40 and 60, depending on the scoops that you're getting or the type of protein. A lot of times whey protein has more grams of protein per scoop than a plant-based. So a lot of times the whey is 25 to 30 grams of protein per scoop. So for her, that could be up towards 60 grams of protein within an hour. So, just everybody really has to have specific macros to their body, their activity level, their medications, macros meaning proteins, carbs, fat. And the same thing goes for supplements. Now, the next thing I was thinking as you were talking about that is people see things on TV and they're like, oh, I should take that. Or they hear things from the media that, for the past 3.5 years with this virus going around, the media says, take zinc, take vitamin D, take echinacea. What they're not mentioning is that vitamin D and zinc can both actually get to toxic levels, and you can get a vitamin D toxicity. I had a client just last week with a vitamin D of 103 and was experiencing vitamin D toxicity symptoms. She thought something hormonally was going on, and I was like, well, you might just be toxic of vitamin D. That may be where a lot of this is coming from. So all of this to dive in to say supplements have to be individualized. We can't just listen to the media. We can't just listen to the commercials and say, okay, I'm going to go take that. It may not be right for your body.
Yep. I think the important thing to note here is that just because the general population is doing it doesn't mean that it's right. I think that's really important to note, that just because the popular media and all the magazines and all the popular things are saying that this is what they're doing doesn't make it right for everybody. It's very rare that you can find a one size fits all anything. I mean, think about clothes. Think about a hat, a one size fits all hat. Does it really fit you, or is it just sitting up there? There's not a, I don't know that I can really think of anything that's one size fits all. And it really does fit everybody the way that it's supposed to be fit.
That's right. And when it comes to supplements, you already touched on this just briefly, is everybody absorbs supplements differently. So things like vitamin B12 and iron are absorbed through the small bowel. If you have any sense of leaky gut or gut permeability, you're not going to absorb those well, versus, some people really absorb a lot of vitamin D when they take it through supplementation, whereas other people don't absorb vitamin D well. So I want to touch just on a couple of the most common supplements in our practice and that we will recommend. One of them that we use most commonly is called Metabolic Xtra, which is by Pure Encapsulations, and it has the active ingredient of berberine. Berberine is a plant sterol. This berberine helps with glucose metabolism. So because majority of our population that we see does have some sense of insulin resistance or pre-diabetes, where their body is not metabolizing glucose or carbohydrate, sugar efficiently, we utilize this plant sterol a lot to help with glucose metabolism or breaking down sugars with the foods that we're eating. This allows the body to get more food or fuel into our cells so that the metabolism can improve, so that we can have less hunger, less cravings for sugar, more energy into the cells, which is going to provide more energy to our brain, more energy overall just to the muscles and to our body. So with insulin resistance, which is that metabolic dysfunction that we're not metabolizing efficiently, we oftentimes will have weight gain, fatigue, poor sleep. We crave sugar and carbohydrates. We have brain fog. And this Metabolic Xtra can be very beneficial to help with breaking down the sugar, which in turn will help us with the symptoms. So again, we're targeting the problem of the glucose being on the outside of our cells and not being utilized for fuel by utilizing the berberine in addition to our meal plan. So it's not a magic pill. We have to eat the right macronutrients along with the berberine, but then the symptoms will improve because we're treating the problem.
Well, before you said that last part there, I was about to say, can I take the Metabolic Xtra every time I want to eat a bunch of cookies?
Yeah, it doesn't work like that. It certainly will help with breaking down the sugar more efficiently. However, there's no magic pill out there. Even the media blowing up Ozempic or semaglutide right now, it's not a magic pill or magic injection. We still have to fuel our body appropriately. We still have to make sure we're getting the right fuel, the right gas, which we talked about just a couple weeks ago on the podcast, getting the right gas to our cells. But it is very beneficial when you're pairing it appropriately.
Oh, man.
Yes. A lot of our clients do find that does help with their cravings and their hunger. But again, this is with getting the adequate amount of protein that your body needs and the adequate amount of fiber and hydration. So that's one of a very common one that we use. Another one that we've been talking about a lot more with our clients lately that I wanted to bring up today is branched chain amino acids. And this is going to go for
Bacchus.
Yes. Branched chain BCAAs, branched chain amino acids. And this is important for all individuals. So young in your teens and 20s and 30s in the gym, exercising, all the way up into our 70s, 80s, 90s, where we are less active, not exercising as often and a little bit more sedentary. The branched chain amino acids, they're 3 of the 9 essential amino acids, and they are very, very important, let me back up a little bit. We have to get them from supplementation or food, and they are very, very important for muscle recovery and preventing muscle loss, which is why I say it's important for us, the younger population, 20s, 30s, and those who are exercising, but also extremely important for those who are in their 70s, 80s, 90s, not as active, because it's going to help with preventing or slowing muscle loss.
Didn't you actually do a study on people who are in an inpatient setting? So you're laying in a hospital bed and you can't physically exert yourself. So the first thing that happens is your muscles start to atrophy at a very fast rate. And didn't you test it to where you actually gave some of those patients the BACAs, the branched chain amino acids, to see if they were able to maintain muscle better than those who didn't get it?
Right. So I actually did my thesis on this. So a lot of research, but yes, it's the final outcome of the study.
The conclusion.
Yeah, was showing that supplementing with branched chain amino acids in a bedridden, sedentary, elderly patient. So in my case, the elderly was 72 or older, and they were bedridden in a hospital bed. Giving them the BCAAs daily, once daily, did slow the progression of atrophy. So it slowed down the muscle loss. It didn't prevent it. It didn't stop it from happening, but significantly slowed the process of muscle breakdown. And so, I think branched chains are really, really important. And a lot of times it comes in a powder form and they're flavored. So it's not like you're taking another capsule or taking another tablet, but it is something else you have to remember to do every day, is dump the little BCAAs in your drink. When you're active and exercising, I highly recommend doing them before or during your workout, as opposed to just randomly throughout the day. However, when we travel, we always bring our branched chain amino acids with us, even if we're not exercising as consistently, to help with maintaining that muscle mass while we're exercising.
Maintaining the guns, baby.
Yes. And I say while we're not exercising, but that's usually just you.
Yeah, that's usually just me sleeping in on vacation days.
So branched chains is definitely something I would consider. The problem with branched chains is there are tons and tons and tons of options out there as far as companies and brands and this and that with branched chains. So you have to be very careful about which brand you're utilizing for branched chains. And you want to make sure it's a clean option. You want to make sure it doesn't have caffeine in it if you are 70 plus and shouldn't be having caffeine, or if you have if you're sensitive to caffeine as a 20 or 30-year-old.
Or if you already are drinking 2 or 3 or 4 or 5 cups of coffee a day.
If you're already consuming caffeine in other forms like pre-workout, I would definitely not recommend taking a pre-workout and then taking a branched chain with caffeine in it, just really dehydrating your body and your muscles. So it's working actually opposite of what you want it to. So finding a clean brand of branched chain amino acids is really, really important, and certainly reach out to us if you have questions about this.
Okay.
So we've talked about two. We use a lot of different types of supplements in our practice based on the client, but I think I'll talk about one more that I think is really beneficial for many individuals because it can touch on different areas of our body, and that is Sereniten Plus, which again is another supplement by Pure. Uh-huh.
Yeah.
What are you going to say? You got really excited.
I love Sereniten Plus.
Jake called it my happy pill for years. So we talked a couple of episodes back, several weeks ago now, about our infertility journey and the amount of stress that my body was under between being very sick, moving to Naples, Jake starting a practice, me trying to pass my boards and start a new career. I moved away from my family. We had just gotten married. And then we start our infertility journal. And to say stress was out of the ordinary is an understatement, right?
To say stress was through the roof would be an understatement.
Yeah. Stress was very high. And my HPA axis, the hypothalamus pituitary adrenal axis, which is the stress axis in our body, was very altered, was not functioning appropriately. Cortisol level, which is the stress hormone from the adrenal gland, was very high. I was just emotionally not there. Or on overdrive. So for a lot of individuals, they can have an elevated cortisol level and they don't even know it. So it's a couple of symptoms of high cortisol levels, which we've talked about in the past, but would be interrupted sleep, not being able to fall asleep and stay asleep at night, waking up feeling exhausted, like you didn't even sleep an hour, but really you were in bed for 10 hours, feeling a little emotionally unstable. So depressed, anxious, angry, irritable, feeling like you're short fused, having a lot of fatigue throughout the day and especially in the evening or the afternoons. Some of these are just the symptoms of having an elevated cortisol level, which is the stress hormone. So Sereniten Plus, which has the active ingredient of L-theanine is an amino acid, so it's all natural, actually helps with calming the stress receptor in our brain, so starting out at the hypothalamus and pituitary, which actually calms the amount of cortisol being released from our adrenal glands. So through what we call a negative feedback loop, which is a lot of information, bottom line is it lowers the cortisol levels within our body. So it calms us, helps us with being able to process stress before we react to stress, helps with sleep, allowing us to get more restful sleep at night and our body to recover.
Love it. Absolutely love it. The first thing that you mentioned as far as symptoms may go, the interrupted sleep, on top of everything that you already mentioned with just getting married, moving here, me starting to practice, you trying to pass boards, this, that, and the other, your first job, you were on call.
Yes.
So not only was your sleep interrupted because of the imbalances, but yeah, now your phone's actually ringing too.
Right.
So you're in pediatric orthopedics, so you had to take turns on who was on call, and it's just like, wow, this is insane.
Yes, my body. And, that was the time where I was very unhealthy. My hair loss, I had been losing hair consistently. My hair was so thin. My eye was thin in general. I wasn't absorbing nutrients well. So I was very, very thin. So yeah, I was extremely unhealthy. And the Sereniten Plus really helped to, as we were figuring out my gut health, the Sereniten Plus really helped with just the simple anxiety that I was feeling on a daily basis, helping me to get more adequate sleep when I was able to sleep and not on call, so that my body was actually recovering and cells were regenerating, and just helping with feeling better overall.
Yes.
So Sereniten Plus is nice because it helps symptomatically, which a lot of people like. They want that immediate gratification. So Sereniten Plus does help symptomatically as it calms that stress receptor, but in the background, it's actually fixing the problem of where your sleep and energy and anxiety are coming from by stabilizing our cortisol levels from the adrenal gland.
Love it.
So that's another really common one. Again, we utilize other things in the office. Magnesium is super important, and we use a specific type of magnesium called magnesium glycinate, which is not so harsh on the stool or on the bowels and doesn't cause really loose stool, but also helps with stress, anxiety, sleep, headaches. We utilize a specific type of vitamin B12 to make sure it's absorbed properly, ubiquinol as opposed to CoQ10. So there's several different types of supplements. L-glutamine is one that we both take for muscle recovery and gut health that a lot of clients use. So there's tons of supplements. We could talk about this for hours and hours and hours, but I did want to touch on those three specifically today.
I think that's great because those are the three biggies. And the most important part about those being the three biggies are the fact that we're not using them as crutches. We're using them as a tool to get to a point where the body is working more efficiently.
Right.
Good.
All right.
That was a lot.
I hope everybody has a great week. If you have questions about these supplements or about other supplements that you may be taking or see on TV, like Go Low or, I don't know, Zinc or whatever else is out on TV and that the media is talking about, please reach out to us or ask a medical professional, somebody that specializes in functional medicine specifically.
Yeah, you got to be careful with that.
Not just any old medical professional, but ask somebody that specializes in functional medicine and really understands what these supplements are doing internally as opposed to prescription medications.
Good. I love it. And quick little plug for us, we are growing faster than we can keep up with. I'm sure, or at least you should know, that we already have our second location opened up in Bonita. That is primarily a golf performance location right now for Berman Golf, our golf performance branch of Berman Inc. However, the goal is to get health and wellness and potentially even physical therapy up there, possibly by this fall or maybe even this coming winter, so January 2024. So if you know any professionals that might want to join our team, a physician assistant who is already currently practicing in functional medicine, a physical therapist who specializes in manual therapy and wants to get out of a corporate mill, a personal trainer who's looking to do more than just personal training and actually be mentored and do more than what they're currently doing as far as just slinging weights around and helping and counting reps for people. What else are we looking for?
Nutritionist or a registered dietitian?
Nutritionists or registered dietitians. So we're always open to interviewing quality candidates. It doesn't mean we're always actively hiring. We are always actively recruiting, though. So we're actually just looking for a reason to hire the next A player to come onto our team and help us grow this thing. So if you know anybody that, even if they don't even live locally, even if they're somewhere else in the States and they want to move back here, send them our way. We would love for you to help us find the next A player to join our team. Health and wellness, physical therapy, golf performance. So a whole wide range of people we're looking for right now. With that said, I think that's all I got to say about that.
All right.
Sound good?
Sounds great. Have a great week. Great Monday.
Great.
Ciao. Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.